welcome to Functional Fridays. I'm Dr. Sherry Jacobs, naturopathic doctor, and I'm with Dr. Shannon Kennedy, internal medicine doctor. And we're getting tons and tons of questions about the COVID vaccine. So we wanted to give you a little bit of update on that. Shannon, what are your thoughts about COVID, how it's rolling out, and what people need to be aware of?
Sure. COVID vaccine is a different sort of vaccine than previous vaccines, so it's hard to say. We're getting a lot of calls about, I've had a reaction to a previous vaccine. How am I going to do with this one? Truthfully, we don't know. We know the one contraindication to getting the vaccine is if you have had an anaphylactic response to previous vaccine. And definitely when you're doing your screening to sign up for the vaccine, they will, sort that out at the time. If you've had flu-like symptoms to a flu vaccine in the past, it's neither here nor there. Most people who get the COVID vaccine feel fine after their first shot, maybe a little achy in the arm, and 3 weeks later after your second shot, usually feel flu-like for up to 3 days. Personally, I got the vaccine and felt fine 24 hours after the first, felt fine after the first vaccine, felt fine 24 hours after the second vaccine, and then at the 24-hour mark, really started feeling fatigued, aches, chills, sore throat, a little cough, which lasted about 24 hours. I slept a lot during that time, and so today I'm 3 days out from it, and I'm feeling back to myself.
Yeah, you seem back to yourself.
Better than yesterday.
Yeah.
I was falling asleep in the office.
Do you think too, maybe having some of those side effects could be a positive response? It's your immune system kicking in, so it doesn't necessarily have to be looked on as a side effect, so to speak, or unwanted side effect.
Absolutely. I felt good that I was having a response to it because I knew my body was fighting, and it needs to build up that response so that if I do get exposed to COVID, I will fight. And so it's good. I'm glad I had that response, and I think it's important to not fear the vaccine. If you're going to get it, to not fear it, because your body is going to experience something, and short of anaphylaxis, life or death, like I can't breathe kind of symptoms, your body is responding as it needs to build up the immune response.
I think that's a really important point too, because you said that when we were in a visit the other day, and I really appreciated it. It's the energy that you put around something that whether that's a food that you're eating or a medication that you're taking or a vaccine, is having the information and having the good feelings around it, and knowing that it's here to help and it's going to do good for your body and do good for the world, right?
Right,
That's
right.
an important connection to make.
Exactly. I think that if you don't feel comfortable getting the COVID vaccine right now, there are plenty of people who do and want the vaccine, and it's coming out as quickly as it's going to come out, and people are going to get the vaccine, and if things continue to go well with it, you might feel more comfortable with it in a few weeks or a few months. Enough people have to get the vaccine to achieve the goal of stopping the spread of the virus. I'm hopeful that enough people will get it, and when we go the route of letting enough people get the virus to achieve herd immunity, it's going to take a long time, and there will also be a lot of deaths, a lot more deaths from getting the virus and getting herd immunity versus giving the vaccine. And I would love to say, neither is necessary, but I feel like a year into this, we're to the point where if you're comfortable getting the vaccine, get it, and if you're not, listen to your body.
Mm-hmm. And keep talking to people, and I think so far we're seeing lots of people do really well with it, and we're going to get more information out day by day. And so one thing I think that's still we don't have in the literature, we don't know about transmission rates right now, and that would be ideal if we knew specifically too that we weren't going to transmit it to other people. But if we know we're going to get less of a effects from the virus, and more people that get the vaccine are going to have less transmissibility all around, because the virus is not going to be as potent and able to cause some of the issues that it's been causing. So
Right. After you get the vaccine, you're still expected, or you're supposed to wear a mask still, and you're supposed to still practice social distancing. So nothing really changes after you get the vaccine, except that if you were to be exposed by a person who was not following the recommendations, then hopefully you wouldn't get sick, or you wouldn't get as sick. When enough of us have the vaccine or have antibodies due to exposure to COVID and actually getting the illness, then we'll be able to take our masks off. But that's not going to happen for a few more months, if not, the end of the year. So.
And it's a really good point, because you can't can't have the false assumption that because you had the vaccine that now, you know, the world is free and you can, you know, you don't have to wash your hands anymore, you don't have to wear that mask. And oh, gosh, I wish it was that way, but
Yes.
we definitely still have to be cautious.
One other thing is that the information regarding getting COVID vaccines is changing by the hour. So a few days ago, here in Charleston, South Carolina, Medical University opened up a link online to sign up to get the vaccine. Within 2 days, it went from having an appointment in February to having an appointment in April. And people were feeling a little frustrated with that. Just in 2 days, all the spots filled up. But within 2 days, Doctors Care is now offering vaccines, COVID vaccines throughout the state of South Carolina. And 12 hours later, Roper St. Francis opened up a phone number to call to get. So we're going to try to keep that information updated. We will send out emails to our patients, but be patient when you call these places or you go online because they're getting thousands of calls all at once. And a few days later, or if you call after hours, what you're going to find is you'll get right through. So, you know, if you're calling and it's really frustrated, don't panic. It's just that a lot of people are, and the more people that sign up and the more people go, the more they'll be able to send out vaccine. And if they see that it's wanted and it's being used, then we'll get it. So patience. Yes, yeah.
Good information.
Yep. So be patient. Don't be fearful. Don't worry, and listen to your body. Yeah.
Thank you.
And take 3 days off around your second vaccine.
Okay, right. Just blanket recommendation.
Yeah. All right.